So basically, it's like this very light tattoo. It's not a tattoo. It's what sort of is in a way.
Very, very superficial.
A very superficial tattoo.
Just enough to create the appearance of a little darker scalp, which will hide the scalp significantly, so it makes the hair that's there jump out way more.
So what I've realized, guys, is that I have a lot of hair at this point after 3 hair transplants on the top of my head, but I have really dark hair and I have very light skin. And so because of that, even with a lot of hair on my head, you still see through a bit of the skin. And so it kind of gives the appearance sometimes, and especially in certain locations, of thin hair. And obviously that's not what I want. I want to look like I have thick hair. That's the whole point. So, hello. So this procedure, it's kind of like what a concealer does. I don't know if any of you guys have ever used concealers, but you've got the powders and the paints and all that kind of stuff. And so this is a bit like not to sound rude, but do you think it's ridiculous after 3 surgeries you still have to put up with this? Not really. That's kind of like saying, do you think it's ridiculous that you still have to comb your hair every day? I mean,
I've never had anybody complain that they have too much hair.
yeah. I mean, that's kind of like, don't you think it's ridiculous that you washed your hair yesterday and you have to do it again today? I mean, there's certain just amounts of upkeep that comes with anything. I mean, it's like saying to an actor, oh, well, you already filmed a movie. Don't you think it's ridiculous that you have to go take more acting classes? I mean, there's no pain. I didn't get any, there's no anesthesia with this. This is like, I don't know. It's about as like, simple a procedure as could be done. And all it's going to do is make it easier for me to comb my hair and make it look good and
Make it look thicker.
Make it look thicker. I often go out without, and I often film a lot of videos that you see on my YouTube channel without any concealers or anything in my hair. But if I really want my hair to look incredible, especially if I'm going to be on stage and there's lots of heavy lights, or I'm filming a video and I'm using a lot of heavy lights. Oh, thanks, man. Yeah, it's going to look even thicker now. Then I'll often use some kind of concealer, whether it's a powder or derm match or something. I'll put in my hair to just make everything look really great. And the powder takes 15 seconds to throw in a little bit of powder and spray on some hairspray, and then it looks great. But how convenient to not even have to do that, Right, I still can if I want to. You can always make something look better. But it's kind of like, I would explain this as a lot of girls get their eyebrows tattooed, So do they have to get their eyebrows tattooed? No. I mean, they can just put eyebrow stuff, or they can just go out naturally and just not have any makeup on there. But the fact is that generally looks better if they put some makeup on their eyebrows. That's why most girls do it every day. And so they get that tattoo done in order to just add convenience, where they don't have to spend the 3 minutes every day, putting the makeup on their eyebrows. So when Dr. McGrath, filled me in on this surgery, but I wouldn't even call it surgery, on this procedure, I was like, man, why not? And we just did a very minor little bit of tattooing a couple days ago, and I was amazed. I was like, wow, this instantly looks so much better. And so I thought, let's just keep going. So it takes usually about 3 to 5 procedures for this to kind of get the full effect. So this is now the sort of second one, or almost like 1.5. And that was actually the first I was the first person that Dr. McGrath did this on, so he was equally impressed. But he's done it on a few other people in practicing, but I was the first of his patients. So we were both just like, wow, this looks so good. It's just,
When you have a patient that's got dark hair and light skin, especially someone like David who's gotten a ton of hair moved, but you still battle with that contrast between the color of the hair and the color of the skin. So what this does is very safely, it helps to remove a lot of that contrast, because you're very superficially coming through here and you're making very small little dots everywhere. And what that does is it makes a nice uniform look to where you don't see the scalp as much. And when you have that, it makes your existing hair just jump out that much more.
yeah. Oh, we just got a comment, Reardon. How do I, all live chat messages? Oh, there we go. So this is from Ladios, and he said, I had one hair transplant so far, and I use Topic on my hairline. Since my hair looks transparent in harsh light or sunlight. I have dark hair and light skin. Maybe that's why. That's exactly why. So, I mean, if you don't like using the Topic, I mean, nobody likes. It's not that much trouble, but nobody likes it. Everybody wants to wake up in the morning with a perfect hair combed and just walk out the door. I mean, that's the dream, right? But in reality, even girls with like incredible hair spend half an hour doing their hair before they go out. So this might be, for instance, for you who just wrote that, this might be we'll answer that question next, might be a great thing for you to look into if you just want the convenience aspect of, either not having to use as much of the Topic, or, being able to go out and look significantly better without having any of the Topic in. I can't really see because this is kind of weird, harsh light, but it just makes an incredible difference. And it's so superficial that it actually starts to fade after it's usually about 3 years, it starts to fade. In about 3 to 5 years, you'd want to go in and get a touch-up, which is kind of a good thing and a bad thing. I mean, the bad part is you have to go get it touched up every now and again, every few years. But the good thing is that it's not permanent, and it's done so superficially that, if for some reason you didn't like it or whatever, I can't imagine why you wouldn't like it, because it's so kind of natural. It's so natural looking that you can't even tell. It's just such a subtle difference. You just suddenly look like your hair's thicker. But it does start to go away. So I kind of like that semi-permanent aspect of it. Depending on pigmentation on an old FUT scar for people who want to keep their hair cut short in the back, does it work? That's a great question. And actually, you guys might have noticed from my videos that I have this giant scar that Dr. McGrath didn't leave me with, but the surgeon I used before Dr. McGrath left me with a giant scar on the back of my neck. And though it's not such a pain to cover up, I definitely can't cut my hair as short because of that in the back. And Dr. McGrath just did one quick session on that scar, and both of us were like, oh my gosh, it looks so much better. So definitely for those scars, it's great.
And we're going to hit it again today.
Yeah, we're going to hit it again today.
We're going to hit it again today. And right now I've got about a third of his scalp done. And if you can imagine, what I'm doing is I'm going in between all his existing hair. And wherever there's a little light spot, I'm hitting it with this little micropigmentation machine, and what it does is it fills in that little white spot with a darker pigment, so that when he combs his hair, it's much more difficult to see the scalp, and that's what it's meant to do. In fact, it's done so superficially that it does require sometimes 3 or more sessions for it to really blend perfectly, but that's worth it because you don't want a scalp tattoo. That you do not want.
Yeah,
that looks really goofy.
You don't want a scalp tattoo. And actually, I'm sorry, we'll answer the hair cloning stuff in just a second. I promise I'll answer all your questions. We got plenty of time here.
Yeah, we're gonna be here for a while.
But what was I just gonna say? I forgot. But so one of the things, let's talk about this, Dr. McGrath, because you're more of an expert than me, especially on this. So hair cloning, that's a big thing that people are talking
Sure.
about right now, you know, because there's a lot of people that are working on trying to make that happen.
Well, I'll tell you the latest information, okay? So guys, good news and bad news. Hair cloning has been done, okay? However, now this is directly from the mouth of the guy who is probably the leader in the world when it comes to cloning of hair. This guy was an active researcher out of Great Britain. And we met at our big conference in Boston a number of years ago. And all of us who do nothing but hair, myself and a lot of my top colleagues, we all tried to pin him down and try to get an idea of, okay, how long is it going to be before we're really going to have this available to the public? And his flat out answer was, he's got no answer. If I had to be honest with you, I would tell you that it's probably not going to be available in our lifetime.
Really?
Yeah.
Wow.
And that's the bad news.
Did you see that Japanese, that Japanese company that they're claiming that they think that they'll have it in like 3 years?
We'll see.
Yeah, I mean, so here's the thing, you know, whether it's 2 years from now, I think this is gonna be 2 years from now. I'm hopeful that 3 to 5 years from now there'll be something available. I'm hopeful, but here's the thing. I guess if it was me, and I'm thinking, like, even if I had in my mind, okay, 4 years from now, hair cloning is going to be available. Well, you got to think about a couple of things. One, do you want to spend the next 4 years with hair that you don't like? I mean, for me, I'm like in the sort of prime of my life, I feel like. I mean, I have lots of business opportunities where I'm performing. I want my hair to look good. Do I want to just wait 4 years in hopes that technology comes out? I'd rather set myself up in a good spot now, and then if it does come out, I can always add more later, you know? But fortunately, with the way that the way that you can do surgery now, if you get a good surgeon and all these different techniques with the skin micropigmentation and FUT and FUE and all of the way that they can be combined in laser, you can get a really good result already, you know? And you can always add to it later. And I feel like, especially with the skin micropigmentation, let's say you're a guy and you're like, hey, I just don't want to have surgery, but I've started to lose some of my hair. I'm seeing a lot of thinning. I'm seeing the skin micropigmentation as being an awesome option, because whether that hair cloning does come out even 3 years from now, I'll answer that question in just a second about the donor hair. Even if that does come out, skin micropigmentation is never going to hurt you. Like it's just a no risk kind of thing. The same way that the laser is. That's why I suggest everyone goes out and buy a laser if you're worried about losing your hair, because there's no downside and there's potentially huge upsides to it. It's just been proven, and we did a video yesterday, which I'll post in a couple weeks, about a little bit more of the science behind the laser. So another thing about the hair cloning is, this is a scientific question I wanted to ask you, Dr. McGrath. I know when you're doing hair transplants, you can only place the hair grafts so close to each other, right?
Right.
So even the maximum amount that you can do is still only about 50% of what like a 12-year-old boy would have as far as the density of hair, right?
Right.
So I don't think that's really going to change with hair cloning. Though
No,
you'll
it's
have
not.
you'll have unlimited donor hair, but you still won't be able to get the thickness that you did when you were like a little kid.
And you've got to think a little bit outside the box and think about the process that's going to be involved in cloning hair. Let's just say, for example, we had it available. Well, they're going to have to get some of your hair, and most likely then it's going to have to be sent off to a facility where they're going to go ahead and try to clone the hair. Okay, that's number one. The point I'm going to be getting at is that the cost that is going to be involved in doing this, if they can perfect it. Now, they have done it, but the problem is that the hair itself only grows through one cycle of hair growth, and then that's it. It stops growing. So that's the problem they're trying to overcome now, is how to get hair that will be able to survive long term.
Okay, so what you're saying is when they can clone the hair right now, what they've been managed to do is clone the hair and then put it in. But then once that hair falls out, once it's gone through the one cycle of hair growth,
it does not regrow.
It does not regrow,
right.
which
so
then
they're
you're
working
screwed.
on that.
Okay.
And I also want you to think about, just for a second, I mean, you're talking about something that most likely, if they perfect it, is going to be really only available to a very select few people, because the cost itself is going to be so cost prohibitive that most people are not going to be able to afford it. Think about it.
Now, why is that it would be so expensive?
It's going to, first of all, that hair, you've got to make sure that it's handled under very strict quality control measures, so that you don't get your hair mixed up with somebody else. It's going to take time for that hair to reproduce in the lab. That's going to require, a tremendous amount of effort on the part of the laboratory. And I'm sure, regulations being what they will, there's going to be a great expense involved in that. And then you're talking about, then, after you've done all that, when it comes time to actually get the hair sent out to the recipient patient, one of the things that is very important when we're doing hair transplant is when we remove the hair and we dissect it under the microscope, there has to be something around that hair, and your body provides that. Your body provides a nice little
That's the fatty
sort of
tissue,
fat
right?
pad.
Yeah.
Right. So what are they going to do to replace the fat pad? What is this tissue going to grow in? Is it going to grow in some type of a natural medium? And then is the hair going to be dissected and then sent in individual follicular units? Or is it going to be sent out in a big, huge swath that you then have to dissect yourself? There's a lot of questions that remain unanswered. And that surrounding tissue that, is sort of holding the graft together and keeping it all in one place is very, very important to the survival of the graft. So what is it that we're going to use? What type of tissue is going to be used to grow that hair?
Okay, I think I'll explain this a little bit more too, because sometimes I think Dr. McGrath, he knows so much that he forgets that you guys don't know this stuff, and even this is things that I'm still learning. Okay, so this is one of the reasons that FUT yields generally such higher results of success per graft, is because, all right, so underneath the hair follicle, there's this layer of fatty tissue. What is that called exactly, Dr. McGrath?
We call it a fat pad.
Okay, fat pad. So you have to have that fat pad inserted with the graft in order for that follicle to grow. If you just pluck the follicle and insert it, it will not grow. So you have to have a certain amount of that fatty tissue in order for the planted follicle to grow. So now what happens with FUE is you have to you poke and then grab and then extract that follicle. But a lot of times, if it's not done perfectly, then you won't have actually grabbed enough of that fatty tissue, which is the part that is really necessary in order for that follicle to grow. So you grab the whole follicle, but that fatty tissue kind of falls apart. I mean, it's like just the gelatin. So
Right.
it's getting it perfectly deep enough that you have enough of that fatty tissue that you've pulled out, that's now going to be a successful hair that you can implant. So what Dr. McGrath is saying is, with this hair cloning, well, you might be able to clone the hair, but then what is that fatty tissue as well that it's going to be in, that you're now going, where are they going to get that from, and where?
Otherwise, you're going to end up with just a whole bucket full of skeletonized hair with nothing around it, and
to protect it and let it grow.
that's one of the downsides of FUE, is that many times when you extract the graft, you're basically FUE, to simplify it, is you're removing the hair using basically they're all the machines are about the same. You're using the equivalent of a drill punch, and usually it's anywhere from 0.8 millimeters to 1 millimeter, and you're coring out the hair. But understand, when you're doing FUE, you're not going all the way down to the level of the follicle. You're just going through the epidermis, which is the superficial layer of the skin, and then the dermis. And then what you're doing is using a specialized pair of tweezers, really, is what they are. You're grasping the hair, and you're pulling it out of the scalp. So you're plucking the hair out of the scalp. And what you end up with, on many cases, is you end up with this skeletonized hair follicle. And what I mean by skeletonized is that when you look at the follicle itself, there's no fat around it at all. It's just follicle and hair shaft. And those typically are not hairs. They can grow. It isn't necessarily true that if you have a skeletonized hair it won't grow. But certainly the graft survival rate is much lower when you have a whole bunch of skeletonized hair.
Yeah.
So Mother Nature, I always say this, you can bend her, but you can't break her. And there's certain things we can get away with and other things you can't. I use the analogy of like having a beautiful little flower that you have, planted as a seed, and it has grown up, and it's in your front garden, in front of your house, and it's turned into this beautiful little plant. And you decide, this would look a lot better maybe in my backyard, so I want to go ahead and move this beautiful flower to my backyard. Well, what most people would do, and common sense would dictate, is that you would get yourself a shovel and you would dig a hole that's probably a foot in diameter around the beautiful flower, and then you would dig well beneath the roots so that you don't damage the roots.
Yeah.
And then you would transplant the entire thing in its totality to another place in your house. As opposed to, wow, this is a really pretty flower. Let me just reach down
and yank it
and
out.
grab it by the edge of the stem, and let me yank it out of the ground, and then see if I can plant it somewhere else and see if it'll grow.
Yeah.
The greater likelihood is that that's going to kill the flower, and it's certainly not going to come back the way it was to begin with. So that's my sort of basic analogy. Obviously, there are people that do FUE and they do it very, very well.
And I just want to make clear too, if you're watching this, Dr. McGrath does tons of FUE procedures, so he's not knocking FUE. We're just kind of trying to explain a little bit more of how it works and why there are these downsides to often doing that procedure.
And there's some places that's all they do is FUE. You guys have probably heard me on video before. The problem I have with a lot of these places where all they do is FUE is many times what you're going to run into is it's going to be a facility where the doctor himself or herself is not even involved in the procedure. They hire technicians to come in and do the whole thing. So the technicians are harvesting the tissue, the technicians are making the recipient incisions, the technicians are transplanting the grafts, everything is being done, and the doctor themselves, they come in, they might draw a hairline, and then they just go away and they leave everything in charge with the technicians, who are usually paid on a daily rate. Many times they're flown in from a different part of the country to work that day. And I've heard these stories, and I've seen and worked with technicians that have told me, the horror stories where they get flown into Ohio or Michigan or whatever, and they show up and the doctor says, okay, we've got an FUE case, and you need to move 2,000 grafts. And it's one technician that has to do the whole thing. And sorry guys, but that's not hair transplant. Just no way, no how. That's not the proper way to do hair restoration surgery. It is something that is going to lead to, if any growth, very poor growth, and it's just not the way it's supposed to be done. That would be the equivalent of me, and I've used this analogy before, and I think that this will sum it up. That would be like, I've got a background in general surgery. That would be like me deciding, hey, you know what, I want to start doing breast augmentation. Okay, well, I've got the skill to do it, and I could probably, go and get a refresher course, and I could probably do a reasonable job at doing breast augmentation, even though I have no business doing it. But imagine if I started doing breast augmentation and I walked into the room and I drew out all the lines and I chose the proper size for the implant and I made all the lines and measurements properly and I did everything I was supposed to do, and then I stood up and I left the room and I said, okay, everybody, take care of it. Let me know when it's done. I'd lose my license in a week.
Yeah.
But lots of places are doing just that. And I don't think you have to be an Einstein to realize that, something's wrong with that model. And I just don't think it's good medicine. There have been several states that have actually outlawed that, because what a lot of people don't realize is that's actually against the law in many states to have a non-physician harvesting tissue from the body. But a lot of people don't know that, so a lot of places will try to get around that by creating what's called a delegation of services agreement, and they say, well, I'm delegating this task to this individual to do X, Y, or Z. But you know what? That's not transplant.
I've got a couple of questions here. I want to go ahead and answer these in case these people are still watching. Let me see. Okay, is the whole thing of not placing grafts close to each other due? Okay, well, let's answer this one first. Let me see where we start. There's a lot. So hair cloning, we answered that already. Hair pigmentation to help cover an old FUT scar, definitely a great idea. You have nothing to lose, and it's definitely going to help cover it. Brenda says, great thing you're doing for yourself. I don't think it's any more ridiculous as the girls who do draw on their eyebrows or tattoo their eyeliner or their lids or permanent lipstick. I don't think it is either, Brenda. Could you ask Dr. McGrath if hair follicle cloning is possible, that itself would solve male pattern hair loss? Yeah, we kind of discussed that. So it's definitely going to help if they're able to figure it all out. But at the moment, it's going to be at least another 3 to 5 years at the soonest before we see the possibility of the public, benefiting from that. Can micropigmentation kill existing hair cells, thus causing more hair loss? I don't think so, right, Dr. McGrath?
No, we're not going anywhere near. We're staying very, very superficial. The depth of this needle is 1/2 of a millimeter. So this is only affecting really the very superficial layer of skin, the epidermis. Yeah. And that's just enough to change the color of the skin to make it look like there's a lot of small little baby hairs that are growing out. That's how it's supposed to look when we complete that. That's why it takes sometimes 3 to 5 sessions to get the results that we're looking to get, because you don't want to go deep.
Yeah.
That's a contraindication.
So yeah, that's very cool. It's not like a hair transplant where you could potentially kill other hairs. So the skin micropigmentation, when done correctly, it will not affect any of your hairs or kill any hair. Let's see. Could this be done for cancer? Could this be done for cancer patients who have lost their hair, or people also who have alopecia? Absolutely.
Sure. And a lot of it, of course, would depend on, how much hair loss they have. But, I mean, we do this all the time with guys that are literally bald guys, but they want to make it look like they've got hair that they just shaved down. So, yeah, that can be done. And depending, of course, on the circumstance and, what style someone's looking for. But, yeah, that could be done.
I'm sure all you guys know who Vin Diesel is. So this is just my guess. Obviously, this is, just a guess. But I think it's a pretty good one. If you'll notice, Vin Diesel was actually pretty bald. Like the top of his head didn't have much hair, and then he shaved his head and became a big, action movie star. But if you'll notice in Vin Diesel's movies, it looks like he has hair, that he just shaves his head, but that he's got this hairline. So I'm pretty sure that that's skin micropigmentation, because a lot of guys who just bick their hair, they also do skin micropigmentation to give it the look of that they have a hairline there, that they're just shaving their hair. And it honestly does look much better. It just kind of frames their face in a better way. Look at more of these. Is the whole thing of not... Oh, do you ever fear that one day when you're older you might run out of donor hair? I don't really, for a couple of different reasons. So, one, I've got a little ways off from that. By that time, the hair cloning and all that kind of stuff actually might be possible because I'm still a young guy. Two,
very young.
Yeah, I've got a lot of hair already still in my hair and in my head, and it's now been 2 years since I had a hair transplant, since my last one, and my hair seems to be keeping up really well using the laser. Now I'm adding this skin micropigmentation, so that's going to help as well. If I use any concealer at all right now, my hair looks incredible. So I don't think I'm really even anywhere close to that. And then at the same time, I still have enough donor hair left because I've done just the FUT procedures. I still have enough donor hair that I can use FUE to go in and fill in other spots in the future. So no, I'm not really worried about that. And let's say hair cloning doesn't happen. Let's say I continue to have a lot of hair loss, and even with a laser it doesn't work, and even the skin micropigmentation and all that kind of stuff. A worst case, science goes down the tubes and I'm 70 years old and I can either just have my hair how it is then and look a little bit thinner like the average guy who's 70 years old anyway, or wear a wig or something. So I mean, there's not at this point, it's not a fear that I have at all but someday I'm going to be screwed and not have any more hair and be bald. I feel very lucky that I because of the situation, the way that things have progressed so far, I don't feel like I have to worry about that. All right, let's go to this. Is the whole thing of not placing grafts too close to each other due to blood supply? Yes, absolutely. That's what it's due to, right, Dr. McGrath?
There's no question. And
yep.
There is a finite amount of hair that, if you base this on, say, 1 square centimeter, and the studies have been very clear, and that's been done by guys that are a lot smarter than me, where they've looked at various hair densities, meaning how many grafts can be placed in a square centimeter. And it's pretty clear that the sweet spot in terms of graft survival is right at about that 25 to 35 follicular units per square centimeter. Now, that may not seem like a lot, but as you go higher, and there's some places out there, they try to get real cute with it, and they try to put 50 to 70 per square centimeter. And, sometimes they can get away with it if they're using very, very small grafts. But the downside is that if you're making that many recipient incisions in a small area, you could effectively compromise the blood supply to that region, and then the tissue itself could actually necrose, turn into a big black scab, and then you're really up a creek.
Yeah, wow. All right, let's look at some more questions here. Thanks for asking these questions, guys. These are great questions, and I hope we're able to help you out here. I was doing some research and found out that some clinics only do 1,000 grafts every day for FUE for a 3-day surgery. Is this done to have minimal scarring as possible? I don't really understand that question. Do you?
Well, let's start off by talking about the obvious. Don't let anybody tell you ever that there's such a thing as a scarless procedure, whether it be strip or FUE. Okay, I could show you photographs of people that have come to me because they've had a bad FUE done, or where they try to over-harvest and try to go for 2,000 or 3,000 grafts.
Yeah, I've seen them.
And then you know, clipper their hair down, and it looks like, you know, they've been shot in the back of their head with a, you know, with a shotgun.
Yeah.
And that's not a pretty sight. I know of only one surgeon in this country, one, who is capable of doing all of that work himself, where he removes the grafts, he makes the incisions, and he places the grafts himself. Now he's a bit of an outlier, and he does very good work. I could never criticize his work. His name is Dr. Mike Voorhees, and he's a phenomenal surgeon. But he's the exception. I don't know of anybody else that does that.
When you say that does what?
Everything himself,
Oh,
from
okay.
start to finish.
Gotcha.
You need to have a team to help you, even if you're doing FUE. You've got to have
Yeah.
a team that helps you with, you know, taking the grafts and trimming them, making sure that they're perfect. There's a lot that goes into it.
Mm-hmm.
I think I've made my feelings pretty clear about some of these places that are just, you know, they want to put anybody in the chair, and they'll tell you whatever you want to hear in terms of, oh yeah, we can do that, we can move this many grafts, no problem. You got to be a little bit leery, and
Yeah.
ask for before and after photos. Ask if the surgeon himself is the one that is harvesting the tissue.
You know, here's a scary thing about the before and after photos thing. This is just something I've realized of being in the hair transplant world. You would not believe the number of surgeons that show before and after photos that actually aren't even their patients.
Yeah.
I mean, literally last night Steve, who does consultations for Dr. McGrath, got an email from someone, and they were like, hey, look, I just was looking at this website of a salon in California, and that salon is selling their laser treatment and showing before and after photos that are one of Dr. McGrath's patients. They're using the before and after photos from one of Dr. McGrath's patients to try and sell, and saying that that was their laser treatment that did that work. So I mean, it's pretty nuts. It's really sad, and I'm really sorry for you guys, you know, the consumer, that you have to deal with that kind of thing. So even before and after treatments, you have to do a little bit of work. If you can, try and even see one of those people in person. So we got the extensive. Oh, sorry about that. Thanks for an extensive answer on hair cloning. My next question is, how many hairs can be totally moved from a donor area to a recipient area through a lifetime of a human being? I don't think that's really, you can't answer that question exactly, can you, Dr. McGrath? Because it depends on...
As a general rule, most patients have about, I would say, 6,000 to 8,000 follicular units that can safely be moved in a lifetime. Now, of course, that can change from individual to individual, but generally speaking, if you're looking at, you know, overall numbers and overall patients, 6,000 to 8,000 is a pretty safe number. So it's not unreasonable to think that you could have 3 2,000 graft cases. I use myself as an example. My mentor, who taught me about hair restoration, he did 3 surgeries on me, and everything on my head is transplanted, and I've had 3 procedures of 2,000 grafts each.
Mm-hmm.
So, and I still have a little bit of available donor hair that I could probably do more if I so chose, but there is a limit before you and I could show you pictures of the back of my head, and I would challenge you to find my scar. So when it's done properly, and you don't try to over-harvest, you can, get a nice closure, you can have minimal scarring, and you can get a pretty decent number.
Yeah. All right, let me look at some of the other questions. And I promise I think we should be able to answer just about everyone's questions. So if you have a question, please post it, and we'll get to it. I'm going through them one at a time here. This is not about hair transplant. Can you give me some advice on how to improve your diction? I'm from India, and I want to have a better accent in speaking English. I think my best
Google Translate.
I would say my best advice actually would be to become friends with somebody who has a really good accent, and just really continue to ask them to criticize you, and just be open to that critique. I mean, because for instance, my wife is Chinese, and I just constantly ask her, okay, did I say this correctly? And she's very happy to point out when I say things with the wrong kind of accent. All right, I've been diagnosed, this is from Johnny Johnson, I've been diagnosed with some minor donor hair miniaturization. Good thing is that I'm only Norwood 2 and already on finasteride. Does such a diagnosis exclude me from hair transplants in the future? Okay, because he's had some minor donor hair miniaturization.
Well, the answer to that question is, if he's on the finasteride, he needs to give it at least 6 to 8 months and make sure that whoever put him on it, that they did good photographs and maybe even did a hair caliper test so that they can assess the progress. And if your hair improves, I've had plenty of patients that I see that have what's called diffuse miniaturizing alopecia, and I'll put them on finasteride, and their results after 6 or 8 months are astounding.
Mm-hmm.
And they come back and they don't even need a transplant then. They've gotten so much improvement that it's amazing. So
we just saw
all
it.
is not lost. Be patient. If you can tolerate the finasteride, which truth is most people can, stay consistent with it and make sure that you're getting good photographs done to assess your progress. Because if you don't have good pictures, I can't tell you the number of times I'll have patients come to see me where another doctor has put them on finasteride and they didn't get any pictures, because it's going to be impossible for you to tell yourself. You're going to look at it and go, oh, I don't see any difference. And when you have good photography, you can assess the changes yourself very, very accurately.
Yeah, I mean, Steve just showed me yesterday a guy who had come into Dr. McGrath's office, an Indian guy, I think, and this guy, the top of his hair was very thin, tons of diffuse hair loss, and Dr. McGrath told him he wanted to have a hair transplant. Dr. McGrath told him, you should not have a hair transplant now, you really need to stabilize this hair loss first. And he got on Propecia, and a year later, I mean, he looked like he didn't need a hair transplant. I mean, it's so much of his hair had come back. So the thing is, just stabilize that first. And I use laser. I'm always pushing that because I just
Yeah, you need to.
Oh, okay. Dr. McGrath's got to run and answer some questions for a patient. Yeah, so I really love the laser. That's what I use personally. And you can use them both. I mean, the more stuff that you can do preventative-wise, the better. So I would suggest, if you're using Propecia, use laser too, Let's look at here. Mahal kita din. Let me see, what is your position on temporary SMP? Is it safe to try? Do you offer that service? Yeah, I mean, Dr. McGrath offers SMP, the temporary SMP, and that's the only kind of SMP, skin micropigmentation, that you should have done. You should not have anything that is going to be permanent. The reason is it bleeds over time. So the kind that you should have done would be the temporary kind that will fade, in the 3 to 5 year kind of time range. That's going to be the most natural looking and just the best choice, and then you can always get it touched up later. So, yep, they do skin micropigmentation, because that's what I'm getting done right now, and I'm really impressed. So, if you want your hair to look thicker and you don't want to have surgery, you should really give the skin micropigmentation a try. How many FUT procedures have you had done? I've had 3 FUT procedures done. Does Dr. McGrath believe one can have a successful hair transplant in the long run without the use of finasteride? That is RSX 2009. All right.
I think it really depends on the individual. If I've got a 22-year-old kid that comes to see me and he's got thinning everywhere, I'm certainly not going to operate on him because he's going to lose more hair, he's going to spend money, he's not going to see any net results, he's going to be upset, and that's just going to create a headache. In contrast to that, if I have a 48-year-old man that comes in that has just some loss in the front but doesn't want to use finasteride, and for the most part most of his hair loss is over, he may lose a little bit more in the future but it's fairly stable, that's a patient where it's not necessarily a game changer. So I think it depends on the age of the patient, the degree of hair loss that they're experiencing, and the nature of the hair loss. Where it is it all miniaturizing? What's the scenario?
Mm-hmm.
So I think that the simple and quick answer to that question is yes, it can be done, but obviously it's very patient dependent.
Yeah.
I know there's a lot of information, guys, out there on the internet that's very scary. I will tell you from firsthand experience, and this is not an exaggeration, I know there's a lot of information about post-finasteride syndrome. I've been doing this work for 15 years, and I have never had a patient ever, not once, that if they got any side effects from the medication, those side effects didn't completely resolve within 2 to 3 weeks of stopping the medicine. I'm not saying that there aren't patients out there that have had issues with it, but I think that with careful screening and proper evaluation, the vast majority of patients that use finasteride will do perfectly fine and have no issue whatsoever. But I know the internet can be a scary thing, and especially young men, they read anything that even remotely says, hey, you might have sexual dysfunction, and then immediately, that's it. They turn it off and go, forget it, I won't even consider that.
Yeah.
When, if you talk to a professional, somebody who's got real experience using these medicines, and I don't mean your local GP, because they're going to be the ones that are scared that if anything happens, they're going to get sued. I'm talking about going to a board-certified American Board of Hair Restoration Surgery, hair restoration surgeon, that's all they do, because they can give you much more accurate and, in my opinion, valuable information about the use of the medicine and how it can or can't affect you.
Cool. Yeah, and I mean, I was on finasteride for years. I never experienced any negative side effects from it. I'm currently not on it. I decided not to because my wife and I are hopefully going to have a baby before too long, and it's better to not be on that when you are. And also, I mean, I read lots of scary stories, and I kind of thought, to me, it was a bit of almost a social experiment on myself. I was like, you know what? I wonder if I can get away with not doing this. I like using the laser. I'm consistent with it, which is the most important thing. I've had this good result. Like, I want to see what happens. And I took a bit of a risk. But so far, I mean, I have had a little bit more recession because I stopped using finasteride, just really in my crown. But overall, I feel like I've been able to pull off making it happen. So, I mean, there's other things you can do. I mean, there are other. I'm currently using the stuff that iRestore sells as well, which is like they've got a medicine, shampoo, all this kind of stuff. And I didn't think it was really going to work that well because I just kind of thought that stuff was mostly sort of snake oil. But I've actually, my hair's felt better since I've started using it. I've been using that, the laser consistently, and I've done pretty well. But at the same time, I have lots of friends that are on finasteride and have never had any negative experiences with it. So, if that's where you're at, and especially if you're not going to very consistently use that laser, popping a pill is way easier and way more convenient, and it does have consistently better results. So what's is Dr. McGrath's thoughts on using hair from other areas of the body, like facial, arm, chest?
Sure.
Have you done many
I think
transplants from those places?
I think it depends on, where exactly you need the hair. Obviously, the texture and consistency of different hair in different parts of the body is different.
Mm-hmm.
And so you have to take that into consideration. But I think that it's done all the time. And I think this, many times it can be very helpful for repairing scars, like if you're going to use chest hair or something, or beard hair. That's very, very good at repairing scars in the back of the head. I don't know if you want chest hair being used, to create the leading edge of your hairline. That might
Yeah.
look a little funny.
Exactly.
So I think it does have its place, and it's useful when it's used, in the right fashion.
Mm-hmm. Well, yeah, these are a lot of really great questions, actually.
Yeah.
The cost of this procedure. So, actually, Dr. McGrath has just started doing this procedure. I think that the cost is going to be around $4,000, and that's for like 3 to 5 sessions. Basically, as much as it takes to get you to the point that you're happy with the way that looks, and that you've been able to fill in that area. And then Steve, Dr. McGrath's consultant, I was just chatting with him about this last night. They were talking about, because there is some kind of upkeep that needs done with it, because it does start to fade after 3 to 5 years. Working on some kind of deal to where the follow-up procedures would be less expensive. So let's say maybe $1,000 to do like the touch-up. So
now, guys, I have not shown David his results yet, and I've just finished the front, the middle, and the sides. We're going to do a little bit more in the back.
I still want to get a little bit further down there too, by the way. Yeah.
But I showed him what the front looked like before, so he has not seen this yet. So this is going to be a first-time reveal, and I'm going to give him the mirror and let him look at it, and then you guys will get to see his response when he sees what this looks like, because this is awesome right now.
Wow.
So I'm going to let him look at it. I'm going to step out. I'll be back in a few minutes, but his hair right now looks like he's got, Topic and Durmatch spread everywhere.
Wow, that is, oh my goodness. Wow. Yeah. Okay, guys, I'll show you. And yeah, no, it's not very painful at all. And I took a little Valium, and now I feel great. So, look at that, guys. I don't have anything in my hair. I have no derm match, no concealer. Oh my gosh. That's incredible. And I have a little bit thinning in the back, so see that. What do you guys think? This is absolutely nothing in my hair. Like, I have no concealer or anything. There's super bright lights over the top. That is amazing. Look at that. What do you guys think? Oh my goodness. Can you believe all that hair? I was bald. Like 6 years ago, I was just a bald dude. That is incredible. You guys see that? Oh my gosh. Wow. You guys have seen my before pictures, right? I wonder if there's a way that I can actually just put a picture in here for you. Doesn't look like it. And the product that I use laser-wise is iRestore, and I actually just did a little partnership with them because I really love their product. And so if you can check out my recent video, it's called Hair Loss Treatments with No Side Effects. It was one of my most recent uploads. Check that out, and there's actually a link in the video description of that video. It's an affiliate link, but if you click on that and then you use my code, which is, I think it's regrowth150, it'll say in the video description. If you use that code, then you get $150 off of the helmet, which I think comes out to around $545 or something like that. which is basically around the cost of using finasteride for like a year. So, and it should be permanent. And they have it's either 6 or 12-month money back guarantee. So if you use it for 6 months and you don't see any results or you don't think it's working, send it back to them, and it'll even pay for shipping to ship it back to them. So like that's the best guarantee in the business when it comes to lasers. I don't think any other company has that good of a guarantee. So 100% money back, including shipping. So I would really check that out. Check out that link in the Iris store. I'll try and answer some more questions for you now. You see?
Oh, wow.
Yeah, that's crazy,
that
right?
Good.
Like crazy.
Oh my gosh.
Wow. Gosh. I'm a skin micropigmentation junkie.
That looks really good.
It's hard because I can't.
That looks really good.
Boy, that's amazing. Let me look at you guys' messages and I'll try and answer more of these myself real quick. How does the doctor deal with people stealing his pictures and using them to advertise their own stuff? Unfortunately, you can send them cease and desist letters and try and sue them, but they always come up with excuses, and unfortunately, there's not a lot that can be done. Are hair vitamin, like hair things like biotin, hair vitamins and stuff, a waste of money? I don't think they're a complete waste, but I don't think they're kind of I think they're kind of an extra. So if you really want to save your money, I'd say don't get them. The only thing that I've tried that I feel like I've had some luck with is the Iris Store 3-pack thing, which is like their vitamin. They've got this shampoo and then this after shampoo stuff that you put on. And that they also have a money back guarantee. So you actually... you can buy the 3-month supply, and then you can send them back the empty bottles after 3 months, and I think they even pay for shipping on that too, and they'll give you 100% money back. So to me, why not give it a try? Because you literally have nothing to lose. If you don't like it or you don't feel like it's working, just send it back, and they're pretty awesome about that. I mean, they were no questions asked, send you all your money back. So you might as well give it a shot. So I would just try them if you're thinking about using the vitamins and stuff. If I need hair transplant in the future, I worry this donor miniaturization will exclude me from the procedure. It could exclude you from the procedure. That's something where you just need to have a really good consultation. Hey David, I'm a 16-year-old girl and I have some bald patches, some hair loss in the front. Do I go to my local doctor or to a hair specialist? You should definitely go to a hair specialist. I would go to, so here's the thing. If you're a 16-year-old girl and you have some bald patches, you should not get a hair transplant. Not yet. Because you're too young. And the way that the female hair pattern baldness works, you'd be much better off starting with laser. I would definitely suggest starting with laser first. You might have an amazing result from that after 12 months. Like I said, Iris Store has that money back guarantee. The next thing you might want to try is like the ACell PRP, which is a very easy procedure. And again, it's quite non-surgical for the most part. You might have some good luck with that. I wouldn't go, especially at your age, go straight into the hair transplant thing. I don't think that'd be a good idea for you. Shampoo and vitamins I currently use is that Iris Store pack. Is it painful? Nope. Looks dense. Oh, thanks. Wow, looks great. You're definitely bringing sexy back. Dr. McGrath is bringing sexy back. I'm just the beneficiary. I'm scared to take finasteride. Hey, I totally understand, But I mean, giving it a try for a little while and then seeing if it affects you, I think you'll probably be okay. Any shampoos for hair loss? You're not going to there's no shampoo that is going to stop hair loss. I think there are shampoos that you can use in combination with those other preventative treatments that might be helpful. It might help, that continued benefit. But don't think, and if anyone tells you that you start using this shampoo and all your hair loss is going to stop and it's going to grow back your hair, that's bullshit. So you change your diet to try to keep your hair healthy. I have a really good diet anyway, and I'm still still been losing my hair. So I think diet is good, just as far as general health goes, but there's no diet you're going to get on that's going to reverse your hair loss, unfortunately. But you should have a good diet anyway, because it's just good for you, and you want to live a long time and look good. And Brenda says Dr. McGrath is handsome.
Well, thank you very much.
Dr. McGrath says thank you.
Please tell my wife that'd be nice.
Dr. McGrath is handsome. I think the white hair looks great on you, Dr. McGrath. I actually think you've gotten better looking the older you've gotten.
Right on.
Yeah. He's got that distinguished older gentleman look. Dr. McGrath's office is in Austin, Texas, which is a really cool city to visit anyway. I live in Nashville, and it's a lot of similar feelings to Nashville. I love Nashville as well. Dude, we've done like an hour and a half on this video. It's the longest YouTube video I've ever done. And Brenda says she likes your white hair. You guys have any other questions? Oh, in your opinion, how many Hollywood actors had hair transplants? Lots. Lots and lots. And I think a lot of them that don't have hair transplants have wigs. We're actually going to do another video about that. Like, for instance, if you really get used to looking for it and you've kind of just spent time noticing people's hair, you'll start to see it. Like, I was watching this recent Kevin Spacey movie, and I could very clearly see the line for his wig on his head. I mean, he was definitely wearing a wig. Nicolas Cage definitely has had plenty of hair transplants. Ben Affleck, I think Ben Affleck just wears a wig. I don't think that he's had a hair transplant, but he's definitely wearing a wig in a lot of his movies. Is Live by Night, I think it was called, his recent movie. I could very clearly see that was not his real hair on a lot of the close-ups. Did you do anything to cover your 3 FUT scars? What's the lowest you go short on the sides? I don't know the exact guard as how low I go short on the sides, but this skin micropigmentation is what I'm doing to cover the FUT scars. But really, the only FUT scar I need to cover is the one that was done by not Dr. McGrath, but the other surgeon that I had on my second procedure. He left me with a giant scar, just because he went way too low in the back of my head. Greedy bastard. But Dr. McGrath's scar, I've never even had to worry about or thought about covering it, because it's, just very minimal. So feel free to ask questions, guys, if you're interested in hair loss. I think I've answered everybody's. Right now what I'm having done is a skin micropigmentation up here. It's just like a very, very light tattoo, but it's not a tattoo. Again, don't get the tattoo. This is kind of a different thing. Do you think FUE is safe? I'm not sure exactly what you mean. Yeah, could you Jesus Primo, could you please clarify that question? Do you think FUE is safe? FUE is not the best choice for most people who are interested in having a hair transplant. It sometimes is a good choice. No, FUE is not any safer than FUT. If you have a good surgeon doing the surgery, each one is equally safe. Does the doctor think the future Dr. McGrath did my third surgery, and those were FUT. He only did my third surgery. I had a different surgeon that did my first and second surgery. The first surgery went really well, and then the second surgery, the doctor was allegedly on drugs, and just not in a good place to be doing hair transplants. Future hair transplants will be in creating artificial skin hair follicles rather than using donor hair. Yes, probably, but that future could be quite a ways off, like many, many years down the line. Does finasteride work for long-term, meaning decades? Yeah, so far. It seems to with most people. Realistically, most people can have 3 FUT procedures. It all varies from patient to patient and the amount of flexibility that you have in your hair. Some people have really tight skin in their head and the back of their neck, and other people have much looser. So it really varies from person to person. But everyone can have 2. Most people can have 3, and some can even have more than that. But if you're looking to really just get the thickest hair possible, and you're a guy who's going very bald, you're looking at having, at least 2, probably 3, maybe 4 procedures over the course of your life. But I'll tell you what, with this skin micropigmentation, it might knock a procedure off of there, just with the amount that it can fill in the whole look that you have. Any other questions, guys? Oh yeah, we did this. I think we forgot to film some of that. How old was I when I started losing my hair? About 21, I guess, probably, when I started losing my hair. You have to wait a year between each procedure with a hair transplant. With a skin micropigmentation, you only have to wait
10 days.
10 days between each procedure, so you can knock it out pretty fast. About a month, and you can be all done. Yeah, I started losing my hair quite young. What is Bianca doing?
She's making my life a little easier because instead of me having to re-dip the ink pen into the, I got smart and I had her draw up a little teeny bit in a insulin syringe.
Oh, okay.
And she's just dropping a drop here and there, and then I can not have to go back and forth.
Oh, wow, cool. Yeah, that speeds everything up.
Okay, so you want the same thing you got last time?
Is it because your dad is bald? Yeah, I think I started going bald maybe even a little earlier than my dad. I've got 4 brothers, and I have the worst hair of all of us. So I just drew the short straw genetically when it comes to my hair. But I have to say, as much as it sucks going bald, and it's crazy the amount of stuff that I've had to do, to combat that, it's actually been a really, I almost wouldn't trade it at this point, because it's been a really cool chance that I've learned a lot about myself, through it. And, I've met a lot of really awesome people, Dr. McGrath being one of them, my friend Steve in the other room. I've just met a lot of cool people, and had the chance to help a lot of other people, so I don't know if I'd really have it any other way. Yep, that's the needle going, you can hear. Dr. McGrath, how many of your patients decide to start finasteride?
I'd say 95% plus.
95% plus. Well,
I really try to educate them properly. And once I've educated my patients and they realize that it's not this horrible, horrific drug that the internet makes it out to be, and then once they see that they get amazing results with it, it really becomes very easy.
mm-hmm.
It is really, really vast minority of patients, very small minority of patients, that if they use the medicine will have any side effects whatsoever.
Mm-hmm.
So guys, don't believe everything that you read.
Yeah, I mean that's the thing. It's like, to a certain degree, if you look at cough medicine and you look at all of the side effects of cough medicine, you know, there'll be like hyperventilating. I mean, look at, if you read the possible side effects to any drug that you would go out and buy, even the most like yeah, ibuprofen has like side effect warnings, and they have those warnings because certain people experience those things from them. That doesn't mean that you shouldn't take ibuprofen. And a lot of that, I think, is just a balance too. You know, if you're someone who can't afford to have a bunch of hair transplants, or doesn't want to use concealer or whatever, then I mean, or isn't going to be consistent with a laser or any of the above, then you need to take Propecia, because you know you have to do something. It's really a personal thing as to balancing, I think. What? That's crazy.
Teriyaki chicken.
Okay, I don't understand this question. What is a hair caliper that was mentioned by the doctor? Is that exam?
It is a device that is used to measure the thickness of a grouping of hairs, and it's pretty accurate in determining if you're getting improvement in the density and quality of your hair.
Oh, okay, gotcha. So that's a device that, for instance, if you were going to get on Propecia, you'd want to measure that at the beginning, and then measure, let's say, 6 months, a year later, and see if you're having improvement, because that way it really gives you an idea of what you can expect in the future. Yeah, that's what makes me confident too, Brenda.
Panda?
Brenda. Yeah, I mean, the reason that I chose to work with Dr. McGrath on this is, you just get a different feeling from different people, and Dr. McGrath, you know, he's been doing this forever. He's an awesome surgeon, but even more than that is he really cares about educating people and about, you know, making the right decision for the patient, not making the decision that's going to make him the most money. I'm sure Dr. McGrath could be making 10 times the amount of money that he does if he just decided to go after that and just give everyone a hair transplant that walked through the door and said that they wanted one. But, you know, his real goal is to help people, and so I want to work with somebody who's that's their goal, is to really help the patient and do what's best for that patient. And I think that's really cool, and is willing to take the time to educate patients so that they make the best decision, not the best decision for them, not the best decision for Dr. McGrath's clinic. And I think a lot of that's just what you're willing to weigh on your conscience, you know? And this person said, hey, you've already done hair transplant. What are you doing now? I'm doing skin micropigmentation right now. So that's like a semi-permanent tattoo that helps just thicken up the look of your hair. Especially for guys like me that have dark hair on very light skin. As much as I have a ton of hair on the top of my head, you'll still get some of that skin shining through, which just makes it look thinner. So this procedure really helps to thicken all of that up. I'll give you over the top of my head view in just a second. Is micropigmentation permanent? It's semi-permanent. So around 3 to 5 years, it will start to fade. So then you would need to get a touch-up. Training hard after FUT, are you still able to be active, work out, or play sports? Yeah, definitely, but you do need to wait a while. So what is the timeline? It's usually, you shouldn't do anything for at least...
Certainly 10 days.
Yeah, 10 days.
If you're doing a strip excision, no lifting, no exercise for 10 days for sure. Once your sutures come out, usually that's about 10 days, then you can start with some light activity. But I tell guys all the time, don't get back in the gym and start doing your 500-pound squats right away, because all of that can take and stretch out the suture line. And part of what we're trying to achieve with the strip excision is not only to get the best quality hair, but you want to be able to make sure that you've got very minimal scarring, and there's things that you can do to improve that. And anything that puts stress on the suture line is something that is going to potentially increase the scarring, and we don't want that.
This is a common question. It's what age should I go for a hair transplant? Currently I'm 21. This is a really complicated question. Correct me if I'm wrong, Dr. McGrath, but I think it really comes down from person to person, and it's all a bit of a personal decision as well. I think generally the longer that you can wait, the better, because then you have more of an idea of how your hair is going to progress. But the first decision shouldn't be, can I get a hair transplant? The first thing should be, what can I do to stabilize my hair loss? You shouldn't just go, okay, I'm losing my hair, I'm going to go get a hair transplant. Like, what are you doing preventatively? Are you on Propecia? Are you using a laser? Are you using minoxidil? Have you tried them all to see which one you're willing to keep up, and if you have any negative experiences with any of them. So it's kind of important to do all those things before you even decide if a hair transplant might be good for you, or before you're even really a candidate for a hair transplant. Is there anything else you want to add to that?
Well, obviously it does vary, and I think that's a very accurate answer that you're giving. The youngest patient that I was ever involved with for a hair transplant was a 16-year-old young man, but his situation was very, very severe, and it was almost life-threatening because of how he was feeling about himself. And so, with the consent of his parents, he did get on finasteride, and a couple of procedures were done, and we got him his hair back, and it was one of these situations where I think we can easily say that in one respect we may have saved his life, because he was talking about he is having ideations of suicide and withdrawing from society and everything else because he felt so badly about how he looked, and we were able to improve that, and I think that was a big deal. But obviously that's the exception, not the rule.
Yeah.
And now, David, what I'm going to do is I'm going to finish this back. This looks pretty good. And then I'm going to take and we're going to do that temple.
All right, cool.
I'm going to need to turn you a little bit
Sure.
to do that. And then I'm going to turn you face down. I'm going to do that scar one more time.
I do not use minoxidil. What do you mean by a candidate for a hair transplant? Well, not everyone is a candidate for a hair transplant or yet a candidate for a hair transplant. So the first thing that really needs to be done, especially if you're a young guy, is to stabilize your hair loss. and figure out what you're going to do preventatively, especially if you're young. If you're an old guy, let's say you're already 60, 70 years old, you pretty much have a good idea of what's going to happen. Let's say you're like 60, 70 years old, and which I don't think is most of you guys. Not most of my YouTube watchers are 70 years old. But just to give you an idea, let's say you're 70, and you still have most of your hair, but just your hairline is gone a bit, and you just want to just fix your hairline. Well, then you probably know that your hair isn't going to really recede that much more beyond what it has. So you might not need to really get on anything, and you could just fix your hairline. But for the person that's a young guy, that's still going to probably have a lot more hair loss, it's much more important that everything gets stabilized and you kind of come up with really what Steve, my friend, Steve Cook, who works here, talks about as a hair transplant plan. It's very important to have a plan going forward, not just jump into I'm going to have a hair transplant and that's the end all be all. What's your life going to be like in 5 years? What are you willing to stick with on 5 years preventative treatment wise? Are you going to do financially, and what kind of position are you in? All of that stuff is just really important.
Mm-hmm. I would say put droplets that are about half the size.
Okay.
Are you planning on getting another hair transplant? At the moment, I don't have any scheduled or any certain one scheduled, but there's a pretty good chance that in the future I'll get some kind of FUE done. I mean, I'm still a really young guy, so I've still got a long ways to go, and you can't really look into the crystal ball and know exactly how your hair is going to change. So I might be good with this for forever, or 3 years from now I might notice more hair loss and have more difficulty covering it in certain areas, and I might want to get a little bit of FUE done. So, but at the moment I'm good for now. That's why I'm getting this SMP done, just to make everything fuller and thicker and more convenient on a daily basis. Well, a hair transplant procedure takes most of the day, but a full hair transplant procedure. But this skin micropigmentation, this is like a few hours. I think we started the video right when I started, and it's about an hour and 20 minutes in, so it's not really that long. So maybe it's 2 or 3 hours total. Well, wearing hat all day, every day, cause hair loss. No, it will not.
Fallacy.
Yep, that's just something. It's just something your mom tells you.
Unless the hat is super, super tight, you're causing any traction on your scalp, but that's
okay.
Usually what ends up happening is people are losing their hair, so they start wearing a hat because they're embarrassed about their hair loss, and then their hair loss continues and they attribute it to the hat. And that's not the way it works. Hair loss is because of DHT and genetics, period, for men. Women's hair loss can be obviously much more complicated and multifactorial, but with men, it's almost strictly related to DHT.
Mm. So feel free to wear a hat, guys. How long does SMP results last? We've answered this, but I know a lot of people are just logging in. So SMP results last for about 3 to 5 years, and then you'll need to get a touch-up. But that's part of the benefit of it, is that it's very surface level. So this isn't something that's going to bleed, like a tattoo would. It's more. So that's why we have a lot of people come into Dr. McGrath's office that have had tattoos done, right? Dr. McGrath, and I think that's why you'd always kind of shied away from skin micropigmentation, because you were like, oh, I've seen those tattoos and those look awful. But this is a very different thing. This is very surface level. It's literally, I think it's like what he said was like 0.1
0.5 millimeters.
0.5 millimeters. So that's tiny that you're going below the skin. And Jesus Primo says, your hair looks great. Been watching your journey for about 2 years. Thank you for all the resourceful information. You're most welcome. It really makes me happy that we've been able to help so many people. I'm turning 25 this year. Do you think I should be waiting longer to begin having a procedure? Again, that really varies from person to person. So I would really just suggest that you call Steve Cook. He does the consultations for Dr. McGrath. And again, he's not going to push you to have a procedure done with Dr. McGrath. He has surgeons all over the world that we know that just do great work that he can recommend if you're on the other side of the world or something. The Dr. McGrath is awesome, so if you can make it over here, I highly recommend you do. But you need to have that consultation. You can't just say, oh, I'm 25, should I have a hair transplant? There's a lot more that you need to discuss. And the thing I like about Steve is that he really gets to know each person and gets to know them on a really deep level.